Hi Internet, I thought I'd do my 2-week update. I mean, technically it's 2 weeks and a day, but I want to talk about some changes that have happened since the body lift surgery, and kind of show you the scars. And pardon my disgusting one drain. I'm going to move this so you're not confronted by the bodily fluids that one leaks when you have a surgery like that. Anyone that's ever had a kind of surgery that required drains, you understand. So that's nothing new, but I'm gonna just spare you from having to see it. So and then I also want to talk about like the next plan, or what I'm hoping for in the future if I can afford it. So update first, like I said, I am down to 1 drain. I started with 4. That's awesome. I will be getting this out for sure in a week, but hopefully sooner than that. 3 weeks is their threshold, apparently. So what does that mean? Well, for the last 2 weeks, I've had to wash my hair in the sink or leaning over the bathtub. I've had to basically give myself like sponge baths. And so I have not been in a shower since the day before surgery. And it sucks. I hate it so much, but I mean, obviously it's worth it. I've also been sleeping in the chair for the past 2 weeks, and I'm getting tired of it because I can't sleep very well in it. I'm doing my best, but my daughter has taken over my spot on the bed, so when it's my turn to come back, I don't know if I'll have a spot. So anyway, I'm healing up really, really well. Today, I'll give you a glimpse here. Today, they took out the sutures from my belly button. So there's some internal ones, and there's like just some scabbing, but that is my belly button. As crazy as this is, I have some abs that you can actually see. See that? Wow, look at that. Sorry, I get fascinated by it because I'm just not used to seeing it. The plastic surgeon said that underneath all of that tissue, I had really lean, toned muscles. Basically, he said if I didn't have all that weight, you could have mistaken me for an aerobics instructor. That's how toned everything was. So, all the working out that I did was wonderful. Clearly, it's been helpful, and certainly probably helped with this part of the recovery too, just because I've been healing so well. So I'm going to expose a little bit of the sutures, or the incision that he did. Obviously, it goes all the way around. It's getting a lot better. You'll notice that the incision itself is not a perfect incision, and the reason why is because we had 2 different people trying to pull up the skin and pull down the skin, and so it's not going to look entirely symmetrical. Plus, we don't heal symmetrically, so I'm still very, very swollen and will be for quite some time, but enough that obviously I can feel a difference in my clothing. I will turn to the side again here. You can kind of see, I mean, this is just unreal to me to see this body. It's still numb right here and down here. So I guess, I could tap on my belly and I can feel the muscles underneath, but I can't feel the skin. So that's a little bizarre. And the whole, like, my skin's exposed, I can't tell because I can't feel it, obviously, if air were to hit it. But I'm hopeful for the future. He says I'm healing very, very well, which leads me to my next discussion. Okay, so the thing that I haven't talked about yet, and I want to, are these. So I have what I'd like to refer to as bat wings, and a lot of them. So it gets really, really bad. And what an arm lift would do would take those arms and basically make them normal again. And it's not, for me, it's not so much the cosmetic thing, but when I run, I actually get rashes up and down here. And even just day-to-day life, it will cause some rashes in my armpits. And that can get really irritating, and it's hard to treat because of the moist location of it, obviously. So yeah, insurance doesn't cover it. Scrounging for pennies, hopefully to be able to cover it and get that done. There's some other things I want to work on eventually, but that's something that I'll just save on my own and do, like potentially having a breast lift. I don't really want to go the implant route. It's really not that bad. cosmetically things are fine. But a lift would be nice just for, really for running's sake. A lot of it's going back to, you know, can I run? And it'll just make it so much easier. The doctor was very positive about the changes to my legs too. I do have some sagging skin on my legs, but that is something that I can actually work on myself through continuing my running, through squats, weight training, bicycle, things like that. And then I can help tone up these legs, which is kind of like my last remaining fat pockets are right in my legs. But basically we're kind of doing it procedure by procedure, which I respect. I really like my surgeon. He says things right as they are, and kind of explains everything really, really well. So I'm happy about that. Of course, I'm thrilled that insurance paid for this because it's an expensive surgery. It's, you know, $14,000 to $18,000 surgery, which is nuts. And there would have just been no way that I could have done it. So for that, I'm incredibly grateful. I've been approved to start walking, and even use an exercise bike. Not crazy exercise, but just enough to kind of get things going. I was out with my appointment today and doing grocery shopping, so I came home and I'm kind of wiped out, to be perfectly honest. But I also find that because of the muscle repair and everything on my stomach, I have a hard time eating. And it's like I was re-sleeved. It's like my stomach is small again. I don't want to eat, and when I do eat, it's always in very, very small amounts. So I'm trying to get protein shakes and make sure that I keep that protein up, so that'll help with the healing. I have another 2 weeks to wear my binder, which I'm kind of getting used to. I have washed it once, so it's not like totally gross. I do wash it. And really, I'm going to feel so much better once that last drain is finally gone. I'll be free. So anyway, that's my update. I'll update again probably in another week once I get this other drain gone, if not before. And feel free to ask me questions. Like I said, I'm an open book. I guess there's a lot of flaws in my body that I see that other people don't see. And I think that's something we probably all deal with. But if I can get this arm stuff gone, Marla will be a happy camper. So there you have it. I will talk to you later.